42 degrees at 4 minutes after the hour, and Dr. Paul Goldhagen, who is an orthopedic surgeon, joins us this morning. And Dr. Goldhagen, good morning to you. Thanks for joining us today.
Good morning. Thank you for having me.
You have an office in Sylacauga. You're on staff in Alexander City.
Yes, sir. Yes, sir. I came to Alex City in 1998. I grew up in Tampa, practiced down there for a few years. Too many orthopedic surgeons in Tampa, so I found a beautiful area in Alex City. We've been here since '98, and since I've been in Alex City, I've known about Sylacauga. I've had quite a few patients from Sylacauga, Fayetteville, and the surrounding area, but I had a very busy practice in Alex City, so it was tough to try and open up a practice up here. I was rehab director in Alex City. In fact, I still am the rehab director at our fitness facility, and I met one of the employees down there, Todd Malone, who was a physical therapist and an athletic trainer, and he left there and actually opened up physical therapy here. He runs Star Physical Therapy here in
Right.
Sylacauga, and he was telling me for years, I need to come up here, but the problem was it was just a matter of time, and I don't like making a commitment somewhere that I can't honor. So I was fortunate enough earlier this year to start looking for a partner, and I actually hired a physician, Dr. Martha George, who had just finished doing a residency at UAB and did a fellowship at Andrews Sports Medicine up in Birmingham, and she started with me in September. And now that I have a partner, we have a little more time, so I decided to open up an office here in Sylacauga.
So you actually opened, what, August or so here?
I opened up in August in anticipation of having, a little more time and having a partner to be able to spread ourselves out and to provide some services to the Sylacauga area.
Is this what you've always wanted to be, an orthopedic surgeon?
Great question. Growing up, my uncle was an orthopedic surgeon, and even before high school, I played most sports, and I just thought it was the coolest thing to work on athletes. And I kind of laughed because I never really wanted to become a doctor. I just wanted to become an orthopedic surgeon. So that's what I've always wanted, pretty much.
Define an orthopedic surgeon. What do you guys do?
Well, we work on the musculoskeletal system, which is bones and joints and muscles and tendons. So everybody thinks, we do fractures and we do sports medicine, but we also do arthritis, aches and pains, sprains, strains, mostly from the neck down.
Mm-hmm. I'm sure that things have changed down through the years from when you first began. What about some of the procedures that you like to do, and what about your favorite procedure?
Well, I love doing sports medicine, and I also like doing arthritis procedures. Total joints are probably one of the most fun procedures that I do, and actually one of the procedures that I've learned to do since graduating from residency is an anterior total hip replacement. Most traditional hip replacements are done from the back, and problems with going from the back is the hip dislocates or comes out of joint. And anyway, just not to belabor the point, but when you go from the front, we don't have to cut any muscles, so it's less pain, quicker recovery. The hip is immediately stable, and I'm still amazed at how well patients do. And I really don't think there's going to be a better procedure that I see in my orthopedic lifetime that has made such a difference in patients' recovery and their pain level from going from the back of the hip to doing a hip replacement from the front.
You're seeing more and more of total hip replacement, total knee replacements, and you see people back to basically a normal lifestyle.
Well, the biggest problem with doing replacements in the past has been the materials, because we just can't replicate the original product. The original product is absolutely amazing, but now the materials are getting so much better, they're lasting 20, 25, 30 plus years. And plus you add that up with the population is aging, but at the same time, we're staying healthier and much more active as we age. So younger and younger patients are actually going in for replacement surgeries, and they're able to get back to their active physical lifestyle.
So really, you see people young and not so young like me.
Well, I see from infants to 100-year-olds. It runs the gamut.
Dr. Paul Goldhagen, who is an orthopedic surgeon who's opened an office in Sylacauga. Now, do you see patients here every day, or how do you see patients in Sylacauga?
Currently, we're seeing patients Monday afternoons.
Okay.
And I have a partner, like I said, we both see patients on Mondays, but we try and make ourselves available whenever we need to. As a situation arises, somebody calls, not everybody can schedule their broken arm or their hurt back, and we understand and we try to accommodate patients as their needs arise.
Mm-hmm. What's the most common need that you see among people in the orthopedic field?
Probably one of the most common ailments of any thing, or one of the most number one reason why anybody goes to see a physician in this country is back pain.
My aching back.
My aching back. Everybody, they bend down to pick something up, or they sneeze, or they sleep wrong, and their back hurts. So we see a whole lot of back pain, and seeing a lot of athletes, we see a whole lot of knee problems just because they're just very common, and it's a very commonly injured joint.
Years ago, I had back surgery. I was injured on the job years ago. And back in that day, I mean, they opened your back up, you know, large incision, long incision. Not like that much anymore.
Correct. One of the major advances in all types of surgery, not just in orthopedics, but is what they call minimally invasive. Trying to make smaller and smaller incisions and do the same procedure. And that has to do with technology and instrumentation, so that not only can we see what we're doing, but we can actually do what we need to do through a much smaller incision, because by doing that, you're disturbing the normal anatomy less, and obviously a smaller incision, you're cutting less muscle, there's less to heal, there's going to be quicker recovery and less pain.
Yeah. If people would like to make an appointment with your office, how do they go about doing that?
Well, they can call my office. My main office number in Alex City is 329-9133. We have a website. It's bonesandjoints.com, B-O-N-E-S, the letter N, J-O-I-N-T-S.com. Also have a Facebook page, Bone and Joint Specialists.
The most common question you're asked about orthopedic care?
That's a tough one.
That wasn't on our notes, by the way.
The common question, I guess, is what do orthopedic surgeons do? I tell people all the time what we do, but I get a ton of people coming, I didn't know you did that. I think arthritis is a main thing. You know, we are experts at treating arthritis. I have patients who I treat for their arthritis, yet they look at me and they say, can you send me to see an arthritis doctor? I say, well, I am one.
You're looking at him.
You're looking at him. So we do arthritis, we do sports, we do fractures. You pull a muscle, you have a question, and if you're not sure, give us a call and we'll tell you if we treat it or not.
Finally this morning, how important is it, Dr. Goldhagen, that we address these issues immediately? Well, I'll just wait. You know, I don't like going to the doctor. You know, how important is it we get a jump start on this thing?
You know, again, that's a really tough question. It's hard to tell. Most patients, you get a little aching pain, or you twist your knee, or you twist your ankle, you're going to try and, quote, suck it up and try and go on. But I guess you got to listen to your body, and you got to. It's a fine line. But if it's not better, with a little bit of ice, a little bit of rest, a Tylenol, if it's not getting better in 4 or 5 days or a week, you come see the doctor. Or I guess if you look and your finger's crooked, you may want to get that taken care of.
One other note this morning, I know that all physicians are busy, whatever the practice they're in, whatever specialty they are experts in. When I go to the doctor, you know, I've got schedules. You know, it's important that I don't wait 4 or 5 hours to see a doctor. What is your thoughts on that?
Well, you know, that's a great point. And since I've been a physician, I understand that my time is no more valuable than a patient's time. And I don't like anybody wasting my time, and I really don't like to waste patients' time. So we actually pride ourselves in trying to be available and to respect that a patient shouldn't be waiting hours and hours to see a physician, or have to wait weeks to get the results from a test. I hear patients all the time, they go to the doctor, a doctor perform a test, I said, well, what did they tell you? I don't know, I'm waiting for them to tell me. And it's weeks and weeks, and that just doesn't sit well with me. Right. So I like to respect the patient's time, but having said that, emergencies do arise. Sure. And we try and keep a tight schedule of patients. We try and see patients on a timely basis. Somebody calls with an emergency or whatever, we try and squeeze them in the same day. But at the same token, when you're squeezing those patients in, somebody's going to end up waiting a little bit. Yeah. So we have to kind of figure that out and move along, and sometimes we have to say no, or sometimes we have to make them wait a day or two, but I really don't like making patients wait, because when you're hurting, you're hurting.
Yeah. Dr. Paul Goldhagen, orthopedic surgeon, our guest this morning. Again, your website, and how can they get in touch with you about an appointment?
256-329-9133 is our main number. We have a website, bonesandjoints.com, and our Facebook page is Bone and Joint Specialists.
All right. Thanks a lot for being with us this morning.
Great. Thank you for having me.
More on Daybreak.